Hi there, I'm Marjorie, the nurse in charge today. Today we'll be studying Mr. Lee as we're suspecting he might have a kind of cancer called head and neck squamous cell carcinoma. Okay, Mr. Lee, I will be taking you to your room and checking you and performing a laryngoscopy, just to take a look at your larynx, which is your voice box. A laryngoscopy is usually performed with a tiny telescope that goes down a patient's nose in order to check his throat and larynx. Mr. Lee has an unusual lump in his throat. In his chart, it says he's 65 years old and he also used to be a heavy drinker and smoker. All of these are common risk factors for this kind of cancer. Unfortunately, Mr. Lee has oral and lip cavity cancer, which is a type of head and neck cancer. This cancer starts in the tissue. The cells in those tissues are responsible for this, and these are called squamous cells. The squamous cells make up the layer of the outer skin and the area inside the mouth and throat. If these cells receive changes from the DNA, then that's when the cancer can be caused. DNA gives specific instructions to these cells, instructions on how often to multiply, when to grow, and when to die. If they get the wrong instruction, let's say instead of dying, keep multiplying, this leads to the formation of a tumor, which is a lump of cells that can even spread and even harm your body. Mr. Lee, I wanted to provide you with additional information on the origin of your cancer. It starts in the lining of the mouth, throat, and larynx. It grows in four stages. Stage one is hyperplasia, which is the overgrowth of cells. Stage two is dysplasia, when the cells start looking abnormal but they haven't spread yet. Stage three is carcinoma in situ, which all the cells located in the lining, they're starting to become cancerous. And stage four, which is the invasive carcinoma, when it spreads to other parts of the body. Currently, you unfortunately do have stage 3. This cancer is two times more common in men aged 50 plus rather than women. 80% survival rate. In Canada, there were 7,900 cases. Out of those, 5,800 of them were men. Okay, Mr. Lee, the genes mutated in this cancer are CDKN2A and TP53. These genes are responsible for preventing cancer, but when mutated, they can lead to it. This cancer can spread to your nose and even lungs. Usually, when diagnosed, 10% of cases have already spread. Luckily, Mr. Lee, like I told you before, you are not stage 4 cancer. Most common treatment options are radiation, chemotherapy, and surgery. For your cancer, we will be doing radiation and surgery. We will remove the cancer tissue and the surrounding healthy tissue to confirm it hasn't spread. Then, with radiation, we will kill any cancer cells that remain and prevent it from spreading. We decided to use this combination therapy thanks to a new research study about tumors and their ecosystem. When considering treatments, it is best to check the ecosystem to have a more precise treatment and prevent anything from being overlooked. Now that we're getting ready for your treatment, just wanted to let you know that there are some side effects for this treatment, like constipation, loss of appetite, and fatigue. If you feel any of these, please contact us and we will help you out. Mr. Lee is cancer free. The area I found that was being overlooked the most was the treatment area. Research on tumors ecosystem is still lacking. Molecular mechanisms aren't being studied enough, so the cells in the tumor ecosystem are being overlooked. This makes it difficult for physicians to target the ecosystem for treatment accurately. A better understanding of the tumor's metabolism can lead to a discovery of any new components that might have been overlooked in the past. This information is crucial for finding and improving existing treatments. Thank you for coming on our journey to treat Mr. Lee. I'm glad we were able to treat his lip and oral cavity cancer and learn more about this type, which is part of the neck and head squamous cell carcinoma.